Assalamu alaikum and good evening everyone from RUWAIS Hospital. Joining us today is Dr. Azam Noor, our consultant general surgery. Today, inshallah, we will be discussing an awareness session with the topic of prostate cancer, in which we will try to go over the causes and ways of dealing with it. As always, please feel free to share your questions, queries throughout the chat. Inshallah, we will try to answer as much as possible. Good evening, doctor.
Assalamu alaikum. Good evening.
The camera is yours.
Well, thank you very much for giving me a chance to speak. After a long time I'm speaking. Anyway, we are going to speak about prostatic cancer. So my basic aim will be to be less on the technical side and more on the awareness side, so that the community knows the presentation, the symptoms of the prostatic cancer. Now, this topic is important for awareness because prostatic cancer is the most or one of the most common cancers, commonest cancers or malignancies of a male. And at the same time that it's so common, the growth rate is slow. So I mean that if you detect the cancer at an earlier stage, then it can be cured. It can be it's like nipping the evil in the bud. So it can be cured, because before it has spread, the rate of spread is very low and slow. And if it is caught and treated in the early stages, it can be cured. This treatment is much successful. But once it has metastasized, once it has spread, the disease is almost incurable. One way or the other, it will kill you. Despite no matter whatever you do about it, all the treatments you resort to, it will still kill the patient. Ultimately, it becomes fatal once it has advanced a certain stage. Now, I will tell you something about what is a prostate gland. Prostate gland is a gland lying at the neck of the bladder, between you can say where the bladder empties into the urethra. It is right located there, and it has its own specific functions. It is a gland because it has got its own secretions. By definition, it is located between the bladder and the penis, or you can say between the bladder neck and the penile urethra. The urethra passes through the center of the prostate gland, meaning that if the prostate gland enlarges, or it suppresses, or it gets obstructed due to some reason, the bladder is obstructed, the urethra is obstructed, the bladder outlet is obstructed, and we will talk about it later. Now, this gland is almost the size of a walnut, and it is just in front of the rectum, to be remembered, because rectal examinations are used clinically. Urethra, as I said, runs through the center of the prostate glands from bladder to the penis, and of course we are voiding through the penis. The males are voiding through the penis. So any obstruction, any infliction, or any pathology of prostate is going to affect the urethra and the outlet or the exit of the bladder, and so urinary output is going to be affected. The function of prostate gland is to secrete prostatic fluid. Now, this prostatic fluid, what is the function of the prostatic fluid? It nourishes and protects the sperms. The sperms, while being ejaculated, are transferred, although in a high speed, but they are transferred through the prostatic fluid, and they are transferred fluid safely and out of the penis during ejaculation. The prostatic gland is maintained, or its life depends on the androgenic hormones, and the most important of which is the testosterone. Like any organ in the body, the prostate gland also has its own afflictions. It has got its own inflammations and tumors also. Of the tumors, there are benign tumors and there are malignant tumors. Now, before coming to the discussion of prostatic cancer or the the malignancies or the tumors of the prostate gland, let me tell you that prostate gland has got anatomically, just to simply mention, because it's inevitable to mention, it has got two zones. It has got a central zone and it has got a peripheral zone. In the central zone is also called a adenomatous zone, from where most of the benign tumors will arise, and there is a peripheral zone from which most of the malignant tumors will arise. So in the peripheral zones, if there is a nodule, now in the central zone, if there is any enlargement or any affliction, it will show very early because it is going to interfere with the urethral output. From the peripheral zone, it needs quite some time, because from peripheral zone to affect the central zone or the prostatic urethra, which is the part of the urethra that passes through the prostate gland, that will take some time. So the prostate gland has two zones, the peripheral and the central. The peripheral zone is mostly associated, or mostly the region of the origin of the malignancies. Yes. The prostatic cancer starts as nodules, and it is interesting to say that most of the frequency of these nodules, they increase with age. For instance, between the age of 50 and 65, only 25%. When necropsies or postmortem biopsies are done, it has been found that between the age of 50 and 65, only 25% of the individuals are found to have the malignant nodules in the prostate gland. But at the age of 80 and above, 70% of the individuals harbor malignant nodules inside the prostate glands. Now you can see how the increase, the remarkable increase with the aging years. Most of the neoplasms are small and they remain latent throughout life, meaning that if the people, even they die at the age of 100 years or even more, they may be having malignant prostatic nodules which did not spread, which remained latent, which remained without spreading, which remained without any affection, and that's how the history of prostate gland goes. So, if these glands, now from this, what I said, it is evident that the rate of progression of prostate nodules, prostate malignancies, is very slow. Now, if these nodules are detected and treated at an early stage, then cure can occur, and the outcome will be very much bright. The progression, the natural history of prostate gland goes like this: that at the age there is prostate gland is it has well differentiated, it is poorly differentiated, or it has spread. Now the detection, the progression of the prostate cancer depends on at what stage it is found or at what stage it is. Well differentiated cancers, they will progress very slowly. They have been found that after 8 years, the rate of progression was only 10 to 14% to advanced prostatic cancers. Moderately differentiated cancers of the prostate, 20% of them progressed. And the cancers which were locally advanced, 50% of them metastasized. There were metastases in 50% of them. So this is how the prostatic cancer will behave. Prostatic cancer is the prostatic malignancy. Like any other malignancy, it is confirmed by a histopathology, but parallel to histopathology, some other tests are done, out of which prostatic specific antigen, which is a hormone, which is a glycoprotein secreted by the prostate gland, is of immense importance, and I will come to it later in this when I come to the relevant section. Now, prostatic gland, how does it present? Prostatic cancer, how does it present? Prostatic cancer will present in a way that a prostatic enlargement will present, meaning that when the prostate gland enlarges, it presses on the urethra. So that is the presentation. The prostatic gland the prostatic cancer presents in a number of ways. The first one is called bladder outlet obstruction. Bladder outlet obstruction means that the patient has some symptoms. The patient will have a reduced flow or frequency of urination, or reduced flow, or impaired emptying of bladder, or hesitancy, or hematuria, which means blood in the urine. So if any of these symptoms are had, then the patient should, it's not must that the patient has malignancy, but the patient should straight away consult the physician or urologist. Then these are bladder outlet obstruction can occur with cancer, and when it occurs, the cancer is somewhat advanced. Or it can occur, or these symptoms can occur more frequently with benign tumors, and so it's not must that if you have got bladder outlet obstruction and you are definitely going to have, or you definitely have a malignancy. No, it's not like that. The second presentation of cancer of the prostate will be pelvic pain because of metastasis, so frequently going to the pelvic bones. Then there can be bone pains. It can metastasize or spread to other bones, and then there can be pancytopenia, means that the whole blood cell count will be reduced. The patient can have malaise, meaning that he is feeling tired all the day, or he can have renal failure due to chronic obstruction. The prostatic cancer, I said about metastasis, it means can spread by local extension, it can spread by blood, or it can spread by lymph. Now, something of importance is screening of the prostate cancer. The screening is done by PSA, which is prostate specific antigen. Now, people who have elevated prostate specific antigen values can be suspected, but it's not a must that they have cancer, but it can only be suspected that they have cancer, and they should undergo further studies. Then, for instance, for example, only 30% of the patients with elevated PSA may have CA. So, and out of the patients who have CA, only 20% have elevated PSA. So it can only be suspected, and it is not a confirmative study. The second one is just doing digital rectal examination, which can also which can also add to the diagnosis, or it should raise, if something suspicious is found, it should lead to further workup. The third one is transurethral ultrasound, which can see the nodules in the prostate, and the fourth one is the biopsy of the prostate gland. If once a histopathology is taken transrectal or through TURP, the specimen is subjected to histopathology, and that can confirm. Histopathology is the confirmative study for prostatic cancer. Now, most of the cancers, how they are detected, most of the cancer of the prostate can be detected in the following, are usually detected in the following ways. One of them is, if they may be lying latent and they are just found at autopsies, meaning after the death, there was a study done, the tissues were autopsied, and CA prostate was found, and the patient died without any symptoms. Second is that there is an incidental finding after transurethral resection of prostate for benign condition. The prostate was resected, and then it was found that the patient had malignancy. So further studies and further treatment needs to be done. The patient, the prostate gland might have localized, might have extended locally, or it might have advanced locally, or it might have spread to the distant regions called metastasis. These are the usual presentations. Now, anything amongst them found, and of all the presentation which I told you about, bladder neck obstruction, pelvic pain, bone pain, pancytopenia, If anything of that occurs in a patient or any one of you or any one of us, then the doctor or the consultant should be seen or should be referred to, and a proper study definitely once the consultation is made, the doctor will go through a battery of studies which will detect or nullify the diagnosis of prostatic cancer. So for the rest of the things, how prostatic cancer is treated, those are technical issues, and I think we don't need to go into that details how prostatic cancer is treated. Your doctor, once you see them, they will treat them depending on which stage the cancer is in. So that is there something technical, and that's all for the time for the community awareness. I think these presentations, some small idea, I think it should be enough. What do you think? Or you need something more?
MashaAllah, doctor, you've covered a lot, but just a final advice for the community, if I may ask. What are the things, or let's just say the foods, just take the foods or drinks or habits, daily habits, that you think they can avoid for such causes, or just normal? What do you think? Just one last advice to the community.
About prostatic cancers, the definite cause is not known.
Exactly.
But in a number of papers, it has been said that those people now, I don't know how helpful it will be to community, but those people, those married couple people, they should not retain their prostatic, meaning that they should not remain without intimacy. They should not remain without sex. This is because prostatic retention fluid is retained when you abstain when the male abstains from the spouse for quite some time. So that has been said to be one cause, that it should be it's the function, it's the physiological function of it, and it should be frequently emptied. So this is one of the it's not worth mentioning in our social conditions, but this is what it is.
No, like, of course.
Yes.
This is
regarding foods, I don't know anything about if some research is there. But even the cause of, like any other malignancy, the causes are not known. What is the exact cause and why it's caused? But it is this what I said about the contact between the spouse, that has been said to be protective. Protective. There are assumptions that it is protective.
Doctor, again, thank you so much for your time today, for all this valuable information. Ladies and gentlemen, this will be all for today evening. I wish you all a great weekend ahead. Thanks again, Doctor, for your time. Be safe, inshallah. And thanks also to Mr. Saddam. How can we forget? For all the help and all the great cooperation. We will be seeing you, inshallah, next week with a new session.
I hope that whatever I said, even if few people they got the message or they got some new information, it's a great success for me, because even if one person is just knew something new, or it's benefits him or her, it will be a big I think my session is successful.
I do think so too, and I think the community, from the way they reacted as well, it was. Thank you so much again, Doctor. We'll be seeing you inshallah in the next session. Have a all lovely weekend, and Assalamu alaikum.
Wa alaikum assalam.